Pharmacotherapy used in complex post-traumatic stress disorder. Here is an overview of what we'll be going over today. What is pharmacotherapy? The targets of pharmacotherapy, the broad drug classes used in therapy, the way drugs work, and extra studies done in pharmacotherapy. So what is pharmacotherapy? Pharmacotherapy is a use of medicinal drugs to help alleviate symptoms of post-traumatic stress disorder. Traditionally, it has been found that psychotherapy or behavioral cognitive therapy has been most effective in helping patients with either PTSD or CPTSD. However, if symptoms persist and one needs additional help, it is possible to use pharmacotherapy to help alleviate the symptoms. Through alleviating symptoms, one would be able to recover faster and cope better with the traumatic events experienced. The aims and targets of pharmacotherapy are to reduce the frequency and intensity of symptoms, such as flashbacks or recurrent dreams of traumatic events, distress to similar situations like the traumatic event, sleep or hypervigilance, difficulty in concentration, accompanying mental states such as depression. Some of the broad drug classes used for CPTSD and PTSD include antidepressants, atypical antipsychotics, benzodiazepines, adrenergic inhibiting agents, as well as anticonvulsants. The first class we will be talking about are antidepressants. They aim to decrease the following: remission rates, sleep disturbances, numbing, hyperarousal, and hypervigilance. So far, there are 4 subclasses of antidepressants. There are selective serotonin reuptake inhibitors, serotonin norepinephrine, tricyclic antidepressants, known as TCAs, and monoamine oxidase inhibitors, known as MAOIs. For selective serotonin reuptake inhibitors, the FDA has approved paroxetine and sertraline. Some of the side effects include insomnia, anxiety, nervousness, headache, nausea, and sexual dysfunction. However, through a study of 395 patients with sertraline and a placebo, around 53% and 60% of men and women respectively responded well to the sertraline. In contrast, 32% and 38% of men and women respectively responded well to the placebo. This indicated the high efficacy of SSRI in decreasing the symptoms of CPTSD. Some of the side effects of SSRI include insomnia, anxiety, nervousness, headache, nausea, and sexual dysfunction. As for SNRIs, only venlafaxine XR has been tested to be effective in helping symptoms associated with avoidance, numbing, and hyperarousal. According to a study using 538 patients in a double-blind 12-week study, around 30% responded well to venlafaxine, 24.3% responded well to the venlafaxine extended release, and 19.6% responded well to the placebo. This indicated that there is a higher efficacy associated well with the venlafaxine XR due to the low remission rate of 24.3%, as opposed to 30% with venlafaxine. In terms of tricyclic antidepressants, there is amitriptyline, phenylazine, and imipramine. Some of the side effects include dry mouth, blurred vision, constipation, urinary retention, and hypotension. For MAO inhibitors, there are also other drugs that are used. However, the side effects are very great. They include liver toxicity, interactions with tyramine-containing foods such as chocolate, as well as hypertensive crises. Although they have been found to be effective in veterans, it is generally not used as first-line treatment for CPTSD due to their high adverse side effects. The The next class will be atypical antipsychotics. Atypical antipsychotics aim to reduce nightmares, disturbing thoughts, irritability, and overall PTSD symptoms. The drugs used in these classes include risperidone, olanzapine, quetiapine, ziprasidone, aripiprazole, olanzapine quetiapine, in conjunction with an SSRI. However, some of the side effects do include weight gain, hyperglycemia, and increased appetite. According to the VA, however, atypical antipsychotics are not recommended in general for therapeutic use. Although it was originally thought to help patients in reducing some of the symptoms associated with CPTSD, it was shown by a study done by the VA that atypical antipsychotics have the same efficacy as placebo. Thus, there is no significant difference in using atypical antipsychotics. In terms of side effects, they may cause hypoglycemia and weight gain, which were not very pleasant side effects. The next class include benzodiazepines. This drug class was typically meant to help reduce arousal and promote sleep. However, through randomized studies, it was found that this class of drugs might even promote depression and development of PTSD or CPTSD. In addition, this class of drugs is more prone to tolerance and disinhibition. Thus, this class of drugs is not used as often for the treatment of CPTSD. The next class of drugs includes your adrenergic inhibiting agents. They aim to reduce your nightmares, sleep disturbances, and overall symptoms associated and related to PTSD or CPTSD. One drug example of this class includes prazosin, an alpha-1 receptor antagonist, which is best when given at night. Another example would be a beta blocker. Beta blockers are used on the basis that there are an excess of norepinephrine in patients with CPTSD or PTSD. By blocking the postsynaptic norepinephrine receptors, there will be decreased norepinephrine in the brain, thus helping alleviate the symptoms of nightmares in PTSD patients. The next class of drugs and final class of drugs used are anticonvulsants. Anticonvulsants aim to reduce intrusive thoughts, flashbacks, and insomnia. Drugs used in anticonvulsants include carbamazepine, valproic acid, topiramate, gabapentin, and lamotrigine. Some of the side effects associated with anticonvulsants include anorexia, nausea, vomiting, and blurred vision. Other drugs in this class, such as topiramate, in which the VA has tested, has been found to be effectual in treating both civilians and combat veterans. Using this clinician-administered PTSD scale, it was found that most patients had a significant decrease in their CAPS score, indicating that they had gotten better with the use of this medication. Carbamazepine has actually also been found to be effectual in the treatment of intrusive thoughts, flashbacks, and insomnia in combat veterans, which is a very difficult population to treat. For the future outlook, according to Medscape and the VA, many of the new drugs that will be coming in the future will be based on the neurobiological basis of CPTSD. In other words, the drugs will be targeting the chemical imbalances in the brain and focus on controlling the levels of norepinephrine, GABA, and other hormones released. In conclusion, the use of SSRIs has found to be the most effective in helping patients with PTSD or CPTSD. However, topiramate has also been found to be effective in helping patients that are either veterans or civilians as well. Gabapentin also holds promise for the treatment of PTSD, and many studies are currently being conducted annually by the Veterans Affairs. Thank you so much for watching this video. If you have any more concerns or questions about how to diagnose PTSD, please refer to the video that is before this video about the symptoms and diagnosis of CPTSD or PTSD.